let's talk about the solutions because that's one of the reasons why you're such a joy to have on Let's Talk America Radio. You are watching our edition of Real Talk, our video series. We're so happy to have you. If you're watching the replay, I am Shayna Thornton. I am the on-air host and executive producer for the program, and we are talking to the one and only acclaimed award-winning internist, Dr. Ken Redcross, a friend of our program here. He's always inspiring and educating us about so many different topics. Tonight, we're talking about diabetes and your
Absolutely.
glucose levels. Is it out of whack? Be careful because the holidays is coming up, and there's so much great, tasty, sweet food to have, Dr.
Oh
Redcross, but
yes.
it
Oh
does
yes.
impact those numbers, which ultimately impact everything else inside of us. But I want to talk about the solutions, right? For
Yeah.
those that may already know it's already up, or they know at Thanksgiving they're going to have at least 3 to 4 slices of
Exactly.
mom's tasty potato pie, but it's real
Yeah.
sugar. It's not
Right. Right. Oh
Splenda.
yeah. Very much so.
They're concerned. What are some things they can do? I know you mentioned diet. Help us out. What can you do doing for diet? And I know you're a big also advocate of fitness. What are some
Yeah.
things we can realistically do because we are working people to make sure we're staying intact?
Well, a couple of things. I want you to show yourself a little TLC, and the T part of that is take a stroll. The reason why I say that, Shane, is there's been so many studies, everyone, that after we eat, that's one of the things they do in Europe. We always talk about the Mediterranean diet, which is by far the best, everyone. But
Yes.
what do they do in Europe? They go out and they take a walk afterwards. We recognize that blood sugar spikes about 60 to 90 minutes after eating. You're going out there when you're exercising, taking even a 2 minute walk will not only decrease your blood sugar, but also increase your insulin's ability to drive that sugar in the cells where it
Wow.
belongs. So make sure that that's a part of it. The other thing is I want you to learn about the herbs and the spices that are out there to help support your blood sugar.
I see.
We talk about cinnamon. Cinnamon doesn't treat diabetes, everyone. That's not the point. The point is it can help support your blood sugar, which is actually it's a bark. The other thing, there's a bark you may not have heard about called berberine. Now, berberine is fascinating because berberine is in the golden seal. It's in the roots and also in the bark, and it's been shown to not only help support blood sugar but also help with those cholesterol levels that we do not want diabetics to have. So when you
Correct.
talk about things like cinnamon, when you talk about things like berberine, these are things that are hard to get in our diet, Shannon. So you need to make sure that you get a good supplement. They always ask me, Doc, where do you go? I like Healthy Directions. It's one of the companies that I know well. They've already done the vetting. I
Okay.
know that the studies are there. So you guys have to do the same sort of research I did with Healthy Directions. Learn more, learn about other companies that have really done the heavy lifting for you to see the studies for yourself and
Yeah.
know how important they really are.
Yeah, that's also key. So I do want to say you said after we eat, to really get up and move, right?
Yep.
2 to 5 minutes. So
Yep.
you're saying it doesn't even have to be a hardcore, I
No.
ran 5 miles. You're saying something is a few minutes?
Well, it is. And when I really mean it, everyone, the studies were 2 to 3 minutes. They did two different studies. They did a stroll, they did a walk, and they did another study when you were just standing. So even after you ate that meal, if you went to Thanksgiving, you may look crazy at Thanksgiving dinner, but if you go and you decide you want to stand for a minute, then okay, you get a little benefit in sugar, believe it or not, because your body requires energy in order to stand. But if
Right.
you move a little bit, you really get a bang for your buck when you do that. Look, we already know that if you exercise 24 minutes a day now, 150 minutes a week, that it
Yeah.
decreases your mortality by 33%. It's
Wow.
that big a deal. So for
Yeah.
my diabetics or for those who don't know that their blood sugar is elevated, you got to make that a part of
Yeah.
the routine and of the regimen.
That's so key. So I want to talk about stress levels because we talk about the holidays. You know that November and December is coming up. Of course, November is National
Yep.
Diabetes Awareness
Yep.
Month, such a very important month for so many different families around the world. But sometimes getting together with family or confronting old past situations is not always peace of
Yeah.
mind.
Yeah.
Dr. Redcross, right? If we're being frank, for a lot of
Yeah.
individuals out there, stress and a correlation with glucose or blood sugar, is there some sort of correlation there?
There is. It's funny, Shane. I always call that word stress. I call it the S word. I never say it because I don't want to give it any more power than it already has in our lives. And so I say this is that no, time to be with the family is an important time. It's
Yes.
very beautiful, right? That's a spiritual being. But we do have to recognize it can be a little bit S word from time in here, and it increases your cortisol. Cortisol is like a sugar, but it also helps you with that fight or flight, right?
I
So
see.
cortisol is good when we need it, but not when we're dealing with that S word during the
Okay.
holidays and so forth. So be very mindful of that. Family is all about love, but sometimes there could be some challenges there. So tell your family, we're not going to do that this holiday. We're
Yes.
going to relax. We're going to love each other. We're going to have some good food. And we're going to do some of the things that Dr. Redcross said and watch what we're eating and
Yeah.
making sure that we're also curbing some of the artificial sugars as well
Yeah.
that's in our food cycle.
I have to bring this up because, along with the holidays, often for so many people around the world, comes the holiday spirits, if you will. I'm talking about what's in the glass.
Oh yeah,
For some people, it's wine or liquor or beer.
right.
Talk to us about that because I hear so many people say, well, I need to watch my carbs, but then they're having full blown
Yeah,
regular calorie beer.
yeah,
Is
yeah.
there a connection? If so, what is it? And help those who say they may want to drink or two at the holidays.
Look, guys, so if you're going to pick something to drink during the holidays, I'd advise you beer isn't the way to go. If you're going to do a glass of wine, you heard me say glass of wine, maybe two. There's a lot of good data on wine, obviously for cardiovascular
Okay.
health. So it is something that we can bring into our diet, but we just need to be careful, make sure it's not excessive, of course. But I can't really get on the beer train. There's
Yeah.
not much that really goes good with that versus the grape, which gives us the resveratrol in the wine. So try to stick to that if you can. And once again, not too much of it.
Yeah, absolutely. And I will say this, I'm sure you agree, as our cardiologists that have come on previously have said, it's not necessarily a reason to start drinking as
There
well,
we
right?
go. I like that. I haven't really thought about it that way, Shada, but you're right. This is not the time to say Dr. Redcross said to start. No, no,
Yeah.
no. You're absolutely right. If you are a wine enthusiast or what have you, once again, just a smidgen, but one or two
Yes.
glasses at a time.
Certainly be mindful. I want to talk about so many people that are pre-diabetic or diabetic also have other existing conditions, right? How mindful should they be of how those other conditions, maybe it's hypertension, maybe it's
Yeah.
dyslipidemia or
Yep.
lupus. How does
Yep.
that affect blood sugar if you are diabetic or pre-diabetic?
Well, see, this is why we're talking about this, and I was very serious. I said 96 million of us out there don't recognize that there is an interrelation with this because the blood sugar story is not only diabetes. You know, blood sugar damages blood vessels. We talked about the little ones in our kidneys
Yes.
and our eyes, but we have the big ones, the ones in our brains and the one that goes to our heart, which
Okay.
later leads to hypertension and, like you said, increased cholesterol. That's why, I have patients who, I'm Western trained, everyone, but I'm not a big fan of meds if we don't need it. So the reason why I mentioned berberine before, and the reason why I mentioned cinnamon, and the reason why I also mentioned chromium, some things that can help support your blood sugar, a lot of my patients want other alternatives in
I
addition
see.
to the
Yeah.
Western medicine and so forth. So this is another way to have a beautiful discussion with your
Yeah.
doctor about, doc, what else is out there? What else can I use to really stay healthy? In addition to what you've written me and think
Yeah.
that I need as well. What can we do to support together?
Right.
So it's that beautiful, interplay and exchange of ideas between the
Yeah.
patient and the doctor.
Yeah, and I think that's so key, Dr. Red Cross. You're so on point because I think obviously the expert is the Dr. Red Cross, it's the doctors out there. But I certainly think that I would think great medical providers want to know where they can meet you, right?
Yeah,
If I'm prescribing 5 and 6 meds and you're not going to take them, that's a failure either
there
way,
we
right?
go.
And the
That's
doctor
right.
certainly can be right. But that if he or she's not going to take it, that patient, it's a dud. And so, where
Yep.
can we meet halfway, right, to make sure this is as productive and as a successful life story as possible?
Absolutely. Well, remember I told you those four things that I live for: the
Yeah,
trust, respect, the empathy. What's the last one? Communication.
yeah,
And that's where that comes in for the doc to say, Doc, talk to me.
yeah,
I understand. Have you heard of this berberine? Have you heard of cinnamon? Have you
yes,
heard of the banana leaf, which is big as far as in East Asia and so forth? Let's have some discussion. Let the doc go home, do a little bit of learning. But once again,
yeah.
a patient would love to have these discussions with their doc to say, is there any other ways that I can help support what we are doing? And that's the key. But it all starts with communication.
It does, but one thing that I think breaks down the communication barrier or prevents it from really happening, sir, I'm going to say is the I word of intimidation. And
Yeah.
I've had the opportunity to speak with individuals that are patients when I'm out and about, and they have expressed that, well, they're the doctor, I don't really know. Or I've known where nurses or nurses, medical aides or medical
Yeah.
assistants will
Uh-huh.
say the patient will tell them everything, right? This isn't working,
Yeah.
that's not
Right.
working, my joints
Right.
are bad. And then the physician or the medical provider walks in the door and they say nothing. And
Yeah.
so if someone is intimidated, right, maybe they're saying, I don't have the medical training of Dr. Redcross. So who am I to challenge or suggest something Do you have any tips for these individuals that may feel like that? And Dr. Redcross, honestly speaking, I think there are probably more people that feel like that are willing to admit it.
Yeah, I think you're right, and I appreciate you for bringing that up, Shayna. Actually, so one of the things I always say is that when you go in and you first meet that doctor, you should feel like that doctor could actually be a member of your family. The reason why I say that, you're not intimidated to talk to your auntie or to your uncle or your
That's
mom or
right.
your dad. Now, it takes a minute to get there. I realize that. But my point is, you can actually feel kind of the energy of someone. Are they going to listen to you? Are they giving you eye contact? Are they making sure to answer your questions directly? Do they answer you back when you need a call back? These are the things that are important to recognize, that the way to get away from that intimidation thing is just to realize I'm just like you. I'm just fortunate and blessed enough to be able to provide care for you, but just recognize docs are the same challenges, the same
That's
problems, the
right.
same headaches and so forth. But just recognize that when we're in that room, we're equals. There's certain things that I know, but there's certain things you know as well that I don't know. And
Yeah.
so I'm just there for a different cause. So
Yeah.
make sure that you go in there and understand, there's only one supreme being out
That's
there,
right.
and we're not it, but we've been bestowed upon the person above to be able to make a difference to the best of our ability. But seriously, it's one of those things that you have to recognize. Quite frankly, you deserve the best. I know
That's right.
why I was created. I know why I'm here. And I'm sure a lot of other docs feel that way as well. So it's okay. Be all right with coming to them and saying, look, I hope this is going to be a great relationship and that it can be filled with tons of communication. You may be
Yes.
surprised by the response you get from the docs when you really look eye to eye and let them know, look,
Yeah.
I get it. I really and truly do.
Yeah, and I will say this. I mean, obviously, you're a great physician, but if the relationship isn't working,
Yeah.
I'm sure there also has to be a point, would you agree, where maybe, I mean, there are other physicians out there for people to not say,
Yeah.
well, I am, and I want to believe every profession and every professional and every profession is wonderful, but they do vary, of course, like
Yep.
with
Yep.
any profession. And if it's not working, I think also we have to be an adult enough to say it's not working and perhaps seek another medical provider.
You have to. And once again, it goes back to that last thing I said, with you deserve the best. And if you really know that, and if you really think that, do you deserve not to be called back? Do you
Yeah,
deserve to be cut off? Do you deserve to be
that's
there
right.
when you paid your hard-earned money for your copay, and there's a doctor in the computer the whole time and not making eye contact with you? You
Correct.
deserve better than that. Absolutely. And so that's when you start the process of asking around. And back to that medical assistant nurse part that you mentioned before, they're the best to ask if they
Yeah,
know any other docs within the practice, or what do you
correct.
think, and that sort of thing, to really start to look outside of that
Yes,
box. None of us are trapped. That's the other thing I need to tell patients. Sometimes they feel trapped. I've been with them for a while. Believe me, there's better out there, but you won't
correct.
know that unless you ask. So don't be afraid to do that.
Absolutely. And when we talked about stress, the S word, rather,
Yeah.
you want to not necessarily feel intimidated or stressed about visiting your medical provider coming visiting you. It should be, of course, something that's a highlight.
Let me tell you, it should. And Shana, this is funny. And my patients, it should be almost a party.
Yeah.
It should almost be a party. I have a patient that texted me just a couple of hours ago before this, who's now down in Florida, and we're
Yeah.
doing our thing long distance.
Yes.
He's moving down there from New York. We're having a party as we talk about what's going on. Diabetes with her as well.
Yeah.
So we're there, excited to come together for me to keep her on that healing journey. For me
Yeah.
to say, be careful when you're on that road. I know
That's
it's
right.
tough to eat well down there. So, in other words, it should be almost a party when you're going to see your doctor. You should have expectations of
Yeah.
getting well, but also checking in, letting the doctor know what you're up to. What is he or she up to?
That's
It should,
right.
it should be a friendship. And like I said before, it should feel like almost catching up with a member of your family.
Yeah. That's so, so key and that's important. What a great conversation with the one and only internist, Dr. Ken Redcross. We are so excited to have you on the show, an
Oh,
acclaimed best-selling author as well, who focuses on the relationship, the bond, the rapport between the patient and the medical provider. What a great conversation about glucose levels being out of control in November and December. Be mindful because we have our New Year's resolutions, right, Dr. Redcross?
yeah,
But
we do.
uh,
Let's do them
we,
earlier.
but we can't fail in November and December and expect to say, well, now I'm ready to take off the 50 pounds.
I agree. It doesn't work that way. I wish it did, but nope, it doesn't.
It's so easy to put on, but harder to take off.
It is. It is. You got to be disciplined, but you can do it. All of you who need to, but believe me, you can do it.
Yeah, before you leave us, I have to talk about one of the biggest trending health topics out there right now. It is influenza, the flu. You and I,
Oh yeah,
this time last year, we were talking about COVID-19, and it's still there.
yeah,
It's still in the background. But the flu has taken over. And, of course,
yeah.
we are based out of Atlanta. Georgia is number 2 in the nation for active flu cases. Help us out. I mean, one, we don't want anyone to get the flu, but if they do, obviously we want to be careful. But I know you've shared before, diabetics have to be extra careful, right? Because they already have a pre-existing health condition.
Yeah, they do. And this is a big time of year to bring this up. You're right. Last year we were dealing with COVID, it's still around, but now we're dealing with an influenza, which is more potent. Think about it, everyone. We didn't even think about it. Now it's back. It looks like it's going to be pretty involved this year, so we need to be ready for that. And whenever you have diabetes or even an elevated blood sugar, you're ripe for that virus to actually come and affect
Mhm.
that immune system and that sort of thing. So it's all about immune health, especially during flu season. But with
Okay.
COVID still lurking and flu season being there, it's even more important. And that you get vaccinated too, especially those who are diabetics and those who later find out that their blood sugar is elevated.
I've got a great question for you. Obviously, we're seeing more flu earlier than in
Yep.
previous seasons, with Georgia being number 2, Washington, D.C. being number 1 in active cases.
Yep.
I've heard so many great physicians like you and pharmacists sometimes say, well, wait to early November to get it so you can have
Oh,
full coverage. But what about now when it's already active and others are
no.
getting sick?
Thank you for bringing that up, Shannon. No, everyone, the best time to get your flu vaccine is usually the middle of October or the end of October. I always worry when some of my patients in September are like, Doc, I went to CVS and I got them. I'm like, no, it's too soon. Because what happens is the immunity wanes, everyone. Don't forget that the flu peaks between December and February. So therefore, you want to be there so you really have that robust response at the right time. So it's the middle of October to the end of October, but not as late as November. Please no.
No, not that late. And so right
No.
now is the perfect time.
Yeah, right.
Okay.
Right now is the perfect time as we talk about it. And like you said, we're seeing these spikes come up. So let's be prepared, especially with COVID still lurking as well.
Yes. And I've got to ask this, the mask, which became so famous during
Yeah,
COVID
I know.
19, the pandemic. Now, the pandemic, of course, has been declared over to some degree by many. Can the
Yeah.
mask help, though, to cut down on the flu or other cases of COVID-19?
Look, it can. And I know it can be controversial, everyone. So this is not really a political debate. Think about this. When you go to the doctor's office or if someone has an operation, you want your doctor operating on you without a mask? No, of course not. We do that to protect you, the patient. So I still think it's important to be mindful. Look at how the flu cases plummeted during COVID as well,
Yeah.
because we were wearing masks for the
Yep.
first time for our
Yep.
culture, at least in the
Correct.
US. So make sure masks are important. So don't make it a political thing or controversial thing. Make it a health thing.
Yeah. So key. So you do believe it can help cut down on
Absolutely.
perhaps getting the flu. So good. Great information to
And the
know.
right mask, Shayna. I'm so sorry, everyone. The right mask. We talk about the N95, which is also a
Okay.
special mask, not the ones that are the scarves and so forth. Not so good, everyone.
Yeah. So get the ones that are officially can help
Yeah,
prevent.
exactly.
I like it. Such a great thing. And I will say this family may not want to see it at Thanksgiving or Christmas, but perhaps even wear it maybe around family at times you're not eating.
Well, you could think about that because don't forget what happens during the Christmas holidays and Thanksgiving. You have your older loved ones that are
Yeah.
there as well. So it's something to think about. Hopefully, everyone's on the same page. Hopefully, a good number have been at least vaccinated and so forth. But just be mindful. Let's not put our guard down. That's the key.
Yeah. Before you leave us, what a great conversation. Of course, you kept off about glucose and high blood sugar and those that are diabetic or pre-diabetic. For someone that's watching us right now, perhaps they're sitting in Houston, Dr. Redcross, they're hearing you talk about the symptoms of frequent urination, being exhausted, and they're thinking, I may have diabetes, right? Because
Yep.
mom, my sister, my cousins have it. But yet to think of a doctor telling them one more piece of bad news on top of everything else going on with inflation, maybe something with their kids
Yep.
or a
Yep.
partner or spouse. Help us out. Make the case, as you always do so eloquently, of hope and being diagnosed and life really being capable of still thriving, even with a diagnosis of type 2 diabetes.
Absolutely. Look, like I always say with my folks who have diabetes and are dealing with it and they feel guilty sometimes, I always say it's not your fault and it's not your fate. And it's the same thing. Don't be afraid to go to the doctor's office because you think you're going to get quote unquote bad news. What you get is news and it can prevent you from death and from morbidity and things of that nature. So you have to go. You have to be a willing participant
That's
in your
right.
health. So don't be afraid, but get that doctor that can make you feel like, once again, they're a member of your family and you feel comfortable saying, all right, give it to me. What do you think? What can we
Yeah.
do together to make sure that I continue on my health journey?
Yeah, and I know often, of course, it's October, Breast Cancer Awareness Month, and so many times
Yeah.
people talk about taking a buddy to
Yeah.
go get a mammogram as well. Oh, you've got on your pink, thank you. You've got on your pink, but take a buddy. If even when it comes to diabetes or any other
Yeah.
condition, if it's helpful, take someone you trust with you, right?
Every time. And not only that, everyone, they do the studies and they always say that when you leave the doctor's office, the patients only remember 20% of what they heard. And not only that, Shana, the 20% they remember, half of it's wrong. So that's
Yeah.
why it's important to bring someone with you to help bring that
Yes.
learning and that retention up a bit. So always bring someone to the doctor's office. Sometimes you get some news that's a little challenging and everything is blanked out and don't realize it's really
Yeah.
not that bad when someone's there to help remind you.
So true. And also, I will say this of any age as well, if someone's in their late 30s
Oh,
or
yeah.
early 40s, jotting things down, right?
Yeah.
Because I mean, that helps for so many people because you may say, I'm hearing it, but if it's news not so great, like you're saying, you may be focused on, I just was told I have a serious disease, and you're missing everything else that came with it.
You're right. I'll say two things to that. So when I mention news that you don't necessarily get, I don't believe in bad news, no matter what the diagnosis. That just lets me know there's just something that we have to tweak.
That's right.
That's all that is. The other thing about making sure you're right, when you go to the doctor's office, this is an active process. Don't go there like, oh, my doctor's office and run in. No, you have a plan,
Yeah.
have a strategy for the 2 to 3 things you want to know when you leave the office
Correct.
that are important to you. So this is an active process. Remember, we talked about it. We're partners. And I'm bringing something to the table. As a partner, please bring something to the table as well so that we can make sure you leave with something special on your visit on the way out to make sure you feel fulfilled.
I love it. What a great word to end on for field, right? That is so key for all of us, no matter what journey it's on, if it's pre-diabetes, diabetes, or all the other health conditions that are countless out there. Dr. Redcross, what a pleasure. Before
Yeah.
you leave us, where can our national and international viewers go for additional information to follow you and get the great tips that you share?
Sure. Feel free to reach out. All of my social media handles are at Dr. Ken Redcross. My website is drkenredcross.com. And by all means, please say hello, ask questions. Definitely. I will always be here to help you during your health journey.
Awesome. Best-selling author and acclaimed internist, Dr. Ken Redcross, here on Let's Talk America's edition of Real Talk. It's our exclusive video series where we interview and chat with the best and the brightest. We keep that conversation engaging. You like this content? Continue to connect with Let's Talk America Radio. We continue to deliver the topics you want to know about with the top experts and advocates out there, such as a Dr. Redcross. Stay tuned in,
Oh,
everyone. For additional information, visit ltaradio.com. That's ltaradio.com, or simply connect with us on social media, hashtag LTA Radio. Thanks, everyone, and stay safe. Thanks, Dr. Redcross.
thank you so much. Be well, everybody.
Thank you.